Good morning, doctor.
Good morning, sir.
Doctor, actually, I have been facing some difficulties for past few months. Actually, uh, I'm a bus conductor, and actually, I'm very active. But some of people say uh, for the past few months, uh, I was inactive, and uh, some of my mobility is uh, slow, and they also uh, look at me often, and they uh, told me I'm not the one who was in the past. So actually, I have a big problem on that. So actually, uh, I was married, and I have two twins, and actually I'm 48 years. So some people say this happens because of your age, and some of my neighbors told me this happened because of your wife always uh, blamed me, and so that get got I that got very stress, and actually that's a very big that's will very big problem in future, and uh, I couldn't be able to even stand or do my works alone, still uh, even is even a small work. So actually I have some symptoms like uh, slowness of movement. Actually a lot of people say in the bus my movements are very slow, and sometimes I do some movements very often, and sometimes I don't uh, uh, smile with them. Sometimes they told me uh, my uh, behavior is uh, uh, very has changed, and uh, sometimes I have a trouble with movements. Sometimes I can't move my hand, and I can't express my expressions, and that's the problem I have, doctor.
Okay, sir. So, according to your symptoms, I guess you have Parkinson. Since you are 48 years old, you are actually somewhat closer to 50 years old, right? So, it is very common to have Parkinson at this age. And so you have to know one thing, that it is good that you have people who care about you, who notice what has changed about you, but you don't have to actually listen to everything people say, like your neighbors. When you see that something about you has changed, you should actually consult someone who can help you instead of listening to everyone's opinion. So it's really good that you have contacted me. So let's get back to Parkinson. Actually, Parkinson is not very rare. You might not have seen many patients with Parkinson, but actually, this is very common these days. More than 10 million people worldwide has Parkinson these days, and most of them are about 50 years old or older. Since you are uh, almost around 50 years old, you can very easily be affected by Parkinson's. So, were you depressed recently?
Actually I depressed most of the time because of my wife. They She blamed me a lot, and sometimes even she hit me by a lot of things that in my house. So actually, I have a big stress. I got stress because of her. I think that that is a big problem.
So, sir, you shouldn't be stressed over such minimal things. After all, she's your family. So, no matter how she treats you now, she will always be there for you when you are sick or when you are at your lowest. So, you have to respect her and listen to her. That most of the time she might be scolding you because you are not listening, you are doing something else, and that's why. So, you have to respect her in the very first place, and also no remember that she will be there no matter what you go through. So you shouldn't be stressed actually about your finance or your family problems. You should be you should have a good mentor here. That is the basic foundation uh, how we can stop further damage by Parkinson's. So do you have any history of Parkinson's with your blood relatives, father, mother, grandparents?
Actually, I think no, doctor. I haven't any family history with Parkinson's. Uh, no, doctor.
So, were you hit on your head or any head injury recently?
Actually, head injuries. Sometimes in the bus, my face is hit by uh, some uh, some bars, but I don't think it goes for a problem like this.
So, I think the main reason you have Parkinson's is because your stressful life. So, take care of your mental health, do some exercises, do some meditations, and all those things. It's not fatal actually, although these symptoms make you feel like it's fatal or I'm going to die, but it's not. It's not curable either, but you can prevent further damage. Um, so were you feeling those recently, or have those been there for years?
No, for not for years, but for a few months, doctor.
Ah, okay. Then you might be in the very early stage of Parkinson. That's really good that you contacted us because it's really easy for us to prevent the further damage when it is diagnosed in the early stage. So the first thing you should do now is to contact a neurologist. I can help you to contact a neurologist in our hospital, or if you like, you can contact someone else either. That's that's your choice. And we can do some MRIs or blood tests to diagnose and diagnose it. Uh, so would you like to go for an MRI?
No problem, doctor. But I haven't, I have a little money. So, is is there any big cost to do
That's
that?
fine. You can go to a government hospital. You can actually do it for free instead of doing it private. And as I said earlier, there are no cures for this. So don't be hopeful about curing this completely, but what you can do is to prevent it by exercises, meditation, and not being stressful. It's a very important thing that you balance your mental health with your other occupation and day-to-day life. So the best thing to do is to contact a neurologist because they are actually brain doctors. They have studied human brain for years and they are very specialized in that field. So if you can contact a neurologist, you can actually get more information and how to go through your medication.
Actually, doctor, I get stressed because most of the time, actually, uh, for uh, uh, before some days, my wife's birthday was on uh, before 2 days, and actually, uh, I requested I requested a leave on that, and I went to a mall to buy some gift for her, and then I saw a big teddy bear, and I bought that teddy bear, giving some uh, money, giving some giving some uh, money. It is not cheap, but it is very beautiful. But when I bring to my wife, she don't like it, and she reject it, and she blamed so much. So like that, as that case, I got stressed because of most of the time. So if you can explain my wife, I will come with my wife in the in uh, in the next meeting. So I think you can explain my wife about that, and she can realize about my uh, disease, and she can help me with treatments. So can you do me a favor like that, doctor?
Of course, I can contact your wife and explain it to her. By the way, sir, do you live with your parents? Do your parents live with you?
Yes, doctor.
Okay, so basically, you are still living with your parents, and your wife has left her parents to come and live with you, right? Uh, so that's a huge sacrifice. You can be at home very comfortably, and instead of that, she has come to your house and she helped your parents and you as well. So you should actually communicate more with her and see what she needs uh, get, before doing something you need. So you should
Actually,
communicate
doctor,
more with her,
I can
avoid it.
understand what you, yes, doctor, I can
Sorry.
understand what you say, but I can understand what you say, but if I but when I bought some gift and bring it to her, she should accept it, because I uh, bought it for her birthday. So uh, uh, I think uh, it is a wrong. She uh, reject rejecting it. So uh, do you agree with me?
Yeah, there's something wrong with by her side as well. So if you can bring your wife with you in the next session, we can actually discuss and solve that as well. But
Yes,
right now,
doctor.
you have to
I will,
think on this
I will,
as
I
the
will come with her definitely. So after that, you can. I think you may understand about her.
okay. So let's see. So do you need any help with contacting a neurologist, or will you do it your
Yes,
own?
please, doctor. If you don't mind, please give me a date for the meeting.
Okay, then I'll contact you this afternoon about this.
Okay, doctor.
Do you
Okay,
have any
thank you,
further
doctor.
questions?
No, doctor.
Okay, then see you later. Thank you.
Right. Wait.